Hello, my name is Eric Prosher, and I'm outreach psychologist at Jesse Brown VA Medical Center, and today we have a real special guest. We're pleased to welcome Mr. Marc Magill, who joins us today, and he is the Medical Center Director for Jesse Brown VA Medical Center, and he oversees the delivery of healthcare to more than 42,000 veterans living in Chicago and northern Indiana. Thank you, Mr. Magill. Thank you for coming on to the show and talk a little bit to get to know you.
Well, thank you.
So you're pretty new to Jesse Brown, and so maybe you can tell us a little bit about your path to Jesse Brown.
Yes, I've been honored for the last 33 years to serve veterans. Jesse Brown is my 10th medical center. Most recently, I came from Colorado, Grand Junction. It serves the western slope of Colorado and southern Wyoming and eastern Utah.
Oh, great. And for those of you that have just joined us, you're watching a live call-in interactive program brought to you by Ken TV 21. We're Jesse Brown VA Medical Center, and if you have questions, we're here. We're going to talk about Mr. Magill's vision, his thoughts, his reflections about Jesse Brown and where we're moving. So you can call us at 312-738-1060. All right. So you've been at 10 different VA facilities. You've been around for a little bit. You've had the lay of the landscape of the VA system. What do you consider is the biggest issue that faces VA, and then maybe Jesse Brown in particular, with regard to its mission?
You know, I know that access is always brought up.
Yeah.
And access to me really means it's not days to get an appointment. It is basically, are we seeing our veterans at the right place and at the right time with the right staff using the right technology? And I think there's some things that are very exciting at Jesse Brown that are allowing us to do that. I think, though, to me, maybe the more pressing issue right now is perception.
Perception.
And there's a lot of folks that would say that someone needs to fix VA. And I'll say VA's not broken.
Yeah.
A lot of things that happen in VA that I believe we should be very proud of. And it's an outstanding healthcare system. Could it use improvement in areas? Yes. But there's a lot of things that we can do that no other healthcare system can do.
Yeah, yeah, I agree that there's a current public narrative that is somewhat negative, and there's a lot of criticism about the VA. That some of it is fair, and a lot of it is unfair. And I recently heard our new Secretary of Department of Veteran Affairs, David Shulkin, indicated that his goals for the VA system is to provide a seamless, comprehensive experience to veterans and their families and caregivers. And he also was very aware of the criticism and said something about building confidence in the veterans.
Yes.
So coming into Jesse Brown from other VA systems, and there's a saying in the VA, they always say, one VA is one VA. What are your first steps to building confidence and working on perception?
I think that you need to have the trust of both your internal and your external stakeholders. And so I've been here a little over 3 months and have reached out to our external stakeholders. Been very fortunate to be able to meet with some of our congressional delegation, met with our union partners, I met with a lot of the veteran service organization leaders that we have in the state and at the federal level, and want to partner with them collaboratively to help make veteran care, not just in Chicago, but on the national level better as well, too. So internally, there's some other things that I'd like to do to improve the veteran experience as well as the employee experience.
Great. Sir, it sounds like we have a caller already, so why don't we put the caller through. Hello, caller.
Hi, I was wondering what Mr. McGill thought of the the impact of veterans and to VA with our new president.
Oh, so what the impact will be on VA healthcare with the Trump presidency?
Yes.
Yes, actually, with the new administration and with our new secretary, I'm actually very excited about some of the opportunities that I think will present. Right now, there is a very good, I think, combined effort, no matter what side of the aisle that you're on, to improve veteran care.
Yeah.
And I think that is good timing because I think we'll have the ability both at the VA to work with our public and private partners to improve that care.
Yeah, and I would say that was probably the first non-controversial appointment was Dr. Shulkin, and I think it was 100 to 0.
It was unanimous.
It was
yes.
unanimous. So
yes.
both sides of the political aisles were support, and this is a bipartisan effort to increase veteran health care. Wow, thank you, caller, for your question. We have another caller. Hello, you're watching CAN TV. We have Mr. Marc Magill, Medical Center Director for Jesse Brown VA. Caller, what is your question?
All right, that's me. Yes, concerning perception. I'd like to know what have the director explain what the VA's current role in the Choice Act is. There seems to be a lot of confusion on that subject.
Yes, choice from the legislative standpoint was designed to improve access of care to veterans, and it was designed based on two factors. First of all, if veteran lived more than a certain mileage rate from their closest VA center. And then secondly, if veterans from a time standpoint were not able to get access to care, say an appointment within 30 days, then choice would allow the veteran to go out in the community and receive that care through the community. Now, what the role of the VA is to be a good partner with that choice provider, but then also I think what we really need to do, and this is a challenge, is to integrate the care that's received out in the community with that we are already providing in the medical center or one of our sites of care.
Thank you, caller, for that question. And I would just add that going back to what does VA do well compared to the private sector, going back to Dr. Sulkin's words, is we provide this comprehensive kind of treatment that is not, that you don't find in the civilian sector. And so going back to what you said about reaching out to community and the integration becomes the challenge.
And I think a perfect example of that is the provision of mental health services. I'm very proud of that, both at Jesse Brown and other sites in the system. There's no other healthcare system that has such a comprehensive package of mental health benefits, and there's no other system that has a lot of the specialized programs that we have, whether that be care for female veterans,
right,
whether that be awareness of homelessness with veterans, whether that be the issue of suicide prevention and awareness, and any of those issues, especially the suicide prevention and awareness. It's very tragic what we have right now.
Yes.
With one time an hour, basically, veteran in this country.
20 veterans a day, and
Yes.
but the news is that most of those veterans have not connected with the VA, and which goes back to another question I had for you, is that recently the VA central office has extended emergency mental health services to veterans with other than honorable discharges who were previously not eligible for VA health care. How do you anticipate that this will impact the caseloads of mental health providers at Jesse Brown VA?
Well, I think it's very important, first of all, to have that expansion. And I think that may actually assist caregivers in providing the mental health services that we do, because you have to look at some of the root issues of those, how they can be resolved. I think if you can look at the family, that's an important part. Involve the family in the provision of care, involve the community in the provision of care, increase the awareness of the community and the community partners that we have that can help with providing those services.
This is great. Wow, you're a popular guy today. We have another caller. Hello, you're watching CAN TV. We're here with Mr. McGill, Medical Center Director for Jesse Brown VA Medical Center. Caller, what is your question?
Well, thank you for taking my call. I guess I just have a couple comments and then a question at the end. First, I'd like to say that I've been coming to the medical center for 10 years, and the OEF clinic has done a fantastic job with my care. And so I just wanted to kind of give you guys kind of a shout out and just kind of say thank you for everything that you've done.
You're welcome.
Okay. And so I guess my question is, so I've been coming to the medical center and I've been getting treatment and care there. And everything's been really great. And I have really no complaints. Except I'm just wondering, like, is there anything that's going to be done with regards to, like, I guess for lack of better words, the objectification of women? I mean, I noticed that, like, when I've gone there, like, sometimes, like, some of the men will, make comments where they'll be like, oh, you have really beautiful eyes, or, ooh, I like the way you're dressed today, or, ooh, you should smile more. And sometimes I just think, like, as a woman, I don't know if I'd feel comfortable in a kind of a male-dominated environment hearing that kind of stuff.
Well, thank you, caller, and that's something that we talked about, the perception. And this is a perception I actually had been made aware of when I first came to Jesse Brown. And besides the fact that I have a wife and two daughters and two granddaughters that I love very much, any employee or any veteran or any family member that comes into our facility, they should be treated with respect. And I want that facility to be known for that respect and to be known as a professional healthcare system. So actually, we started a campaign, a culture change campaign, and the first part of that is just really to increase awareness. And I brought two buttons. I wanted to hope that I had the chance to show, but these two buttons basically, don't know whether it can see, but one is a name tag. And it's the typical red and white name tag that you might see folks wear, but it says, instead of hello, my name is, it says, hello, my name is, not hey baby. And then for the male staff to wear, we have a button that says proud male ally in making public spaces safe for women. And so,
You can see that on the screen right there.
those are just buttons. I think the first point, or how you first start in fixing this is you increase the awareness of what the issue is. I do have a group of staff that have come together. They're actually very excited about some ideas to fix this, and I've asked them to provide me some recommendations that then I can take and I can implement to fix this very issue that you're discussing.
And I'm also aware of some initiatives. As you may know, caller, April is April is Sexual Assault Awareness Month. And so this is where this kind of converges it with the VA and veteran care, because we have a protected group called MST, Military Sexual Trauma Survivors. And for all employees at Jesse Brown VA, every Tuesday they are encouraged to wear the color teal and denim to show solidarity for survivors of sexual assault. And on April 4th, which will kick off this event, it will be in the prescription conference room from 12 to 2. There will be Standing Together and to Empower Sexual Trauma Survivors. And there will be a ceremony and a clothesline project that will be displayed. And then there will be information about upcoming workshops that will be taking place throughout the month.
And
That
Eric,
sounds really, really
I
good.
think that's another example of, again, there's no other healthcare system outside of VA that would have that type of program.
Yes.
And so again, I'm very proud of that, not just at Jesse Brown, but in VA.
Yeah. Yes. Thank you, caller, for that very important question and comments.
All right. Well, thank you. Thank you for taking my call.
All right. Yeah. So in our psychology meetings, these topics have come up, and we've talked about ideas, and I know there's these committees that are rallying around to make some changes. And I wasn't able to make the last meeting, but I was like, there's certain areas where you see it happen, and there is, if there was like a how to intervene as a bystander, like an education thing, that could really make a difference. I know even in Chicago with the violence, there was these public health programs called violence interrupters, where they would have people within the community that would step up and intervene, before things got out of hand. And like, for example, one area that's notorious for like these comments are like the guys smoking out in front. And so I wonder if like there could be like interrupters that would, as women would walk by, but hey, that's not, that's my, please, that's not respectful, or something like that.
And I think you really hit on something, because it is a speaking up.
Mm-hmm.
And I think that our staff, I'm very proud of our staff, but if our staff see something that is not quite right, I want them to feel safe in speaking up about that and letting me be aware of situations so I can help and support and hopefully implement programs and policies that will cut down on things like this.
Yeah. Have you ever had an experience where you might have thought it was a good idea and you agreed with it, but no one else was willing to listen to someone in your organization?
I at least personally have the philosophy that every idea is good.
Okay.
There's no such thing as a bad idea. And so one thing that I like to do with my team and the folks at Jesse Brown is I want to hear all ideas.
Uh-huh.
And I think in a lot of cases we can try out an idea and we can either prove or disprove its value.
Uh-huh.
And so I like to kind of think outside the lines.
I really like that
regards to
approach.
that.
I really like that approach. And even coming you're coming on a show like this and taking questions from callers is really shows your openness and excitement about new ideas.
Thank
So if anyone else has any questions, our time is running short, and we have 5 minutes left. You can call 312-738-1060. I know sometimes, as I've been at Jesse Brown VA since 2006, and I can't believe it's 2017 already. Time flies. But we've had different changes in leadership, and oftentimes while we're waiting for the leadership, the middle managers kind of keep status quo, and afraid to try new things. So it's very exciting to have a new visionary for our hospital.
Thank you.
So, what's the best experience you've had in the past year?
I would say, again, I'm humbled to be the director at Jesse Brown. Lots of good staff there. I'm proud of the folks that every day come to work and work very hard to make life better and care better for our veterans. And whether that's in the emergency department or whether that's on the inpatient ward with our nurses, with our doctors, whether that's in the clinics, whether that's in ancillary services like radiology or pharmacy, any of those, they're all important. Our housekeepers, I'm so proud of our housekeepers. They have a very important job.
Yes.
It's not just making the place look nice. It's basically having an environment that's infection-free and very safe for our patients. So I want to thank our staff.
Excellent. Wow. Okay, we have one more caller, it sounds like. Hello, you're here with Mr. McGill. We're talking about Jesse Brown VA. Caller, what is your question?
Well, just a quick question. It seems as though the director is very receptive to input from veterans. I just wondered if there's an existing methodology for veterans to provide input to the director.
Yes, actually several. The most recently, I hosted a town hall. I have pledged to have a public town hall at least once a quarter. That's in the Chicago area. We also have 4 other sites of care, and I'd like to get out to those sites and those communities as well and have town halls. The other way is we have a lot of committees, a lot of special groups, and I plan to have veteran focus on those and veteran representation on those. Another way, just very quickly, we have veteran service organizations. I'm very active with coming to any post meetings or any time that we're invited out in the community to interact with those veteran groups and again get the word out about our service. But that's how I hear what's going on out in our market, out in the community. So again, I can hopefully help improve veteran care.
Thank you, caller, for your question.
Thank you for taking my call.
Great. So we have a few minutes left. I want to make a couple announcements. First, I wanted to congratulate Sherry Pollack, who's the head of the Employee Wellness Committee, for the gold level site of excellence Jesse Brown is for their best practices in employee wellness. Congratulations, Sherry Pollack. And I also wanted to make an announcement about improving relationships after deployment. There is, we're outreaching. Life can be difficult after deployment, and many veterans struggle with making that transition back in their marriage and relationships. So we have Dr. Alba, who is trained in couples therapy, and we're looking to develop some workshops to help relationships thrive after deployment. Also, we have, it's the end of flu season, but it's still not too, it's not too late to get the flu shot. So come on in. We have a free flu vaccine will be available to veterans at Jesse Brown VA and all community-based outpatient clinics. The flu clinic is open Monday through Friday from 8:30 a.m. to 4 p.m. and it's located in room 1458 in the first floor of the Damon building. So stop the flu, it starts with you. Mr. McGill, I wanted to thank you again for giving us your time and sharing with us some of your thoughts about Jesse Brown's, your plans for Jesse Brown. Please tune in. The next time we'll be here April 27th. And following us, Fathers Who Care, please stay tuned in the next 5 minutes. Now, for veterans that are in need, don't forget we have a veteran crisis line. We can speak to a live person 24 hours a day, 7 days a week, and that's 1-800-255-TALK. Press 1 for veterans, and also check us out on Facebook, VA Chicago. Goodbye for now.